This is my health assessment for head to toe assessment for Lana Charvat for health assessment class. I've got my client ready to go and I am going to come in and do a head to toe assessment on her. So I'm knocking on the door. Hello.
Hi.
Hi. My name is Lana. I'm your nurse today and I'm going to do a head to toe assessment on you. Is that okay?
That's okay.
I'm going to make sure I do good hand hygiene. I'm going to ensure privacy for the client. Could you tell me what your name and date of birth is, please?
My name is Jane Doe, and it's 5/1/49.
Okay, thank you. And I checked that with her record, and it's correct, so that's good. When I start my assessment, immediately when I walk in, I'm noticing things about my client. I'm inspecting for cognition, for skin color, for all kinds of different things. That's all going to play into the assessment as I go along. Okay, to start with today, I'm going to take a full set of vitals. So I will take her blood pressure, and as I'm doing this, I'll kind of ask her now, Sharon, what is your normal blood pressure run?
120/80.
Okay, and so we'll look for that today. We'll take her blood pressure, and it goes about the same. So we have 120/80, which is good. Then I'm going to check her. I'm going to put this on your finger. What this is a pulse oximeter, and it's going to tell me what the oxygen level of your blood is currently, okay? It's also going to tell me what the little case falls out, your heart rate is, okay? And it looks like her blood oxygen level is 97% and her heart rate is at 88, which is good because that's right in range. We'd like to see your oxygen level between 95 and 100%, and your heart rate can range from 60 to 100, okay? And then next I'm going to check her temperature. And with an adult, I'm going to make sure I pull her ear pinna up and back. And her temperature is normal. That looks good. And how have you been feeling today, Sharon?
I'm feeling pretty good. I've been feeling pretty good
Okay.
today.
And I've also checked her respiratory rate for 1 full minute. I'll check her respirations. We were looking for between 12 and 20, and we'll say she's right in mid-range, so that is good. The other thing I'm going to check for is a pain level. So Jane, today would you say rate your pain on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain you've ever had?
Oh, let's say 6 today.
Okay, and what would you say that is due to?
I think the cool weather, the damp weather,
Okay.
and just a little more walking I've done today.
Yeah. Okay, so have you taken anything for that pain?
I take an ibuprofen, like 2 of them, they're 200 milligrams.
Okay, and does that seem to relieve it?
It seems to give me relief.
Okay, and if it doesn't, we'll address that with your doctor, okay? Okay, so now I have her main vitals done. I'm also going to check the client's height and weight. So we did that already. We've got your height, we've got your weight. I'll check that against the BMI record or chart. And if someone is below 18.5, they would be considered underweight. If someone is above 30, they would be considered obese. Okay? Okay, moving on. I'm going to start with my head to toe inspection. And I'm going to start with the head. I'm going to put some gloves on, and I'm going to inspect the client's hair through her hair and everything, and just to make sure that there's no lumps, bumps, indentations, or anything of concern, any moles or things we need to watch for. As I'm looking, I'm noting the hygiene, her overall hygiene, but also in her hair too. It looks really good. She's got clean hair, nothing oily, looks like she takes good care of it. I'm noticing that I don't see any issue with any lice or nits or anything like that. I don't notice any alopecia or anything else on her hair, so that is really good. When I take my gloves off, I'll have to wash my hands. Now I'm going to check a couple of her cranial nerves. In her head, right now in this inspection, I'm going to check for cranial nerve number 7 and number 5. Now with cranial nerve number 7, I'm going to ask you to close your eyes tight and then open them. Okay? And are you able to smile and frown for me? Perfect. And can you blow out your cheeks like this? Perfect. Okay, that's what we're looking for. And then for cranial nerve number 5, can you bite down? Okay, and then I'm going to give you a little resistance. Can you open your mouth? Perfect. Okay, so all of that seems intact and looks good. Can I ask you to remove your glasses? I'm just going to palpate your sinuses. Do you notice any pain or tenderness when I palpate this is her maxillary sinuses and her temporal? No pain or anything with that. Do you have any concerns with your sinuses or any history of?
Occasionally, I do take a antihistamine. for a couple days to
Okay.
early season of the spring.
Seasonal allergies?
Yeah.
Okay. That sounds good. I'm gonna also want to check her temporal arteries. And they are palpating +2, normal, which looks good, okay? So now as I'm gonna move on, I'm gonna inspect her eyes. One of the things I'm gonna do a couple of checks on your eyes. One of the things I'm gonna have you do is I'm gonna have you focus on my pen here, and I'm gonna check the 6 cardinal fields of gaze for you, okay? So as I do this, just focus on the pen and follow it, please, with just your eyes. Try and keep your head real straight. Okay, good job. She did good with that. Now, when I'm working with, I'm going to check her pupils. I'm going to dim the lights, and we're going to check with a pen light. Okay, now I'm going to shine this light in your eyes, and what I'm looking for is the constriction and dilation of your pupils, okay? So just look straight ahead, and I'm just going to come in off the side. Looks good. Good. Okay, and her eyes seem to constrict and dilate appropriately. That is good. The next thing I'm going to do is have you kind of look off into the distance, focus on something, and I'm going to put my pen up in front of you, and then I'm going to move it towards your nose. And as I do that, let your eyes follow it. I want to check your accommodation. Almost touching your nose. Perfect. And that looks good. So I've checked her, I've assessed her for Perla. Her pupils are equal, round, reactive to light, and they accommodate. So that's what we want to see. So that looks really good. Okay, as I was doing that also, I was looking at her eyes, making sure that there's no jaundice. Her scleria looks really clear. It's white, which is what we need. We don't want it yellow. I don't notice any bloodshot. When I look at her conjunctiva, it's pink and appropriate, looks good. Her lids, her eyes are symmetrical, lids shut and open as they should, so that all looks really good. Okay, next thing I'm going to do is I want to check inspect her ears. I have a little pretend otoscope here. But have you had any concerns with any ear infections or anything?
I've never had an ear infection that I know of, that I
Okay.
can remember, so I think I'm very lucky.
Okay, so I am going to look into her. I'm going to palpate a little bit and around. Do you notice any tenderness, any pain?
No.
Okay, and as I look into the ear, what I'm looking for is the tympanic membrane. I want to make sure that it is pearly gray. It is shiny and translucent, which it is. And then I'll check her other side, and that the same looks really good. So that is good. And I also check the cone of light in her eyes for the right side should be 5 o'clock, left side 7 o'clock. And that when I look in that light, I notice that in your ears. Okay, so I'm going to occlude one of your ears, and I'm going to say 2 words, and I'd like you to repeat them. If you can look straight ahead.
Yellow banana.
And then I'm going to go on this side.
Cat dog.
Perfect. Okay. So that seems to be, that's intact. So that's checking her cranial nerve number 8. Next, I'm going to look at her nose. I'm going to check her with the light. I will look at her nose is midline with her face. Everything seems to be okay. Can you occlude one of your nostrils and breathe okay through it? Okay. Then the other side. And I'm just going to look up there, see if I see any nodules or anything of concern. Her septum, everything looks normal. No drainage to be concerned with. Everything looks normal, so that is good. I'm also going to check your cranial nerve number 1. If you notice this, tell me what this smell is.
Coconut?
Coconut, yep, it is. So I know that the olfactory nerve is intact and correct. Next, I'm going to take a tongue blade, and when I'm looking in her mouth, I'll run out of gloves, but I'll don gloves, and I've got my pen light, and I will put a tongue blade in her mouth, and I'm going to look at her tongue. I'm going to observe her cheeks. I'm going to look for any white spots, anything in her in cavities, broken teeth, different things like that. I'm going to ask her to stick her tongue out and move it from side to side. Good. It's checking her cranial nerves. And also when I'm going to depress her tongue and I ask her to say ah. And I'm watching the uvula in the back to make sure it's moving appropriately and it's midline. Looks good. Now checking underneath her tongue, I'm looking for any white patches. Sometimes white patches that indicate oral cancers like to hide under there. So that's good to follow up with and check as well. Then I'll remove my gloves and do good oral hygiene again. I also know just from talking to her that cranial nerve number 10 is good because she's able to verbalize with me and speak, so that's good too. Okay, next I'm gonna check her neck, and I'm gonna look midline at her trachea. I see everything is even the way it should be. I'm gonna palpate for lymph nodes all the way around in each area. Make sure that they are appropriate. I don't feel anything to be concerned of. I'm going to take my stethoscope and I'm going to check her carotid arteries. First I'm going to palpate them, and they're 2+ bounding, really good, both sides. And then after doing that, I will check with the bell of my stethoscope. I'll ask her to breathe in and out and then hold it. And I'm just checking for any swishing sound. Breathe in and out and hold. And if I don't notice that, that's really good, so I don't notice a bruit or any concern in her carotid arteries. Okay, next thing I'm going to check would be her arms. I notice her skin color, her arms look really good. I don't notice any lesions or breakdown. I'm looking at her joints. I'm going to check the range of motion in her arms. We can do passive or active range of motion in her fingers. I'm going to check the capillary refill on her fingers. It's less than 2 seconds, so that's really good. I'll check both arms. I don't notice any concerns with her joints, fingers, everything moving around. We've done the range of motion. That looks really good. So I can check her brachial pulses and her radial pulses as well. And they're 2+ bounding and look good too. Okay? All right, so next after that, we're going to inspect the chest. And I'm going to do heart sounds. Normally, I would have her remove her, she'd be in a hospital gown, and I would have her expose the chest so I get a good sound. But when checking the chest for heart sounds, I'm going to start with the apex or the aortic, and then I'm going to go to the pulmonic, and I'm going to do Erb's point, and I'm going to go down to the tricuspid and then the mitral. I'm going to check each valve of her heart, make sure that it sounds good, it sounds appropriate, nothing of concern. Once I've done that, I will also use the bell sound, and I will do the bell side of my stethoscope, and I'm going to check in the same pattern, same areas, and what I'm looking for is any heart murmurs. So that seems to be all looking good. I want to check her lung sounds next. So what I'm looking for when I check the lung sounds is I'm looking for any adventitious sounds of wheezing or stridor or friction rub, anything like that. So when checking the lungs, like in that case too, she would have her chest bare, and I could easily check. I'm going to start anterior, and I'm going to go to make sure I check each lobe. And I would move in that sort of a pattern, just down to make sure that I get all areas. And then when I get, also when I listen to them, I want to listen to a full lung sounds, and I'll ask her to deep breathe and in and out when I'm doing that, so that I get a good sound. And then I'd also want to do that on her back as well. And then keep having her breathe deep in and out. And as I'm doing that too, I'm watching the shape of her chest. You know, I'm looking for use of accessory muscles. I'm looking for the barrel chest, which is very common in people that have COPD or difficulty with breathing. So that's something to look for too. Okay, everything seems to look good in the chest area. And then next I'm going to ask her, might be a little bit difficult, but if you want to lay down a little bit, and then I'm going to check your abdomen.
Do you want like my hand on the pillow?
Yeah.
I'll get up a little closer.
Just so we can see it in the camera too.
Oh, okay, yeah.
Sorry.
No, that's okay. I'm gonna just.
Not the perfect place. But she would also be, I would have ability to look at her abdomen closely. So what I'm going to do is when I check in for bowel sounds, I'm going to start in the right lower quadrant, and I would assess, and then I'm going to move clockwise. When was it the last time you had a bowel movement?
I would say this morning.
Okay, or do you have any issues with constipation or diarrhea?
No.
Okay,
actually.
sounds good. And I've noticed her bowel sounds are all active. They're not hyper or hypo. They're just normal, and they sound productive. So that's really good. The other thing too is if I notice that there's no bowel sound, I would really want to listen for a full 5 minutes before I really get to that conclusion that there is no bowel sound. Sometimes it takes a little while. And when I'm assessing someone's abdomen, what I want to do is listen first before I palpate. Reason for that is because if you palpate first and then listen, you might have those bowels really moving, and I wouldn't get a true accurate picture. So that's why I assessed first with osculation, and then now I'm going to do palpation. To start with someone, when you're doing assessing the abdomen, you want to do light palpation first, which I'll do. And I'll just work kind of in the same clockwise pattern. And then I would do deeper palpation. And I'm looking for any masses, lumps, abnormalities, anything of concern. And I don't feel anything. It all seems good. So we don't have any concern with that. Okay, so you could sit up. Sorry about that.
Oh, no, that's okay.
And then, do you have any concerns with your bladder? Do you seem to have any issues with urination, any burning, itching, or?
No, I've been very fortunate
Okay.
at my age.
Okay, and those could all be signs of a urinary tract infection, so it's always very important to drink lots of water and to if you have any issues with that, report it to your doctor so we can do something about it, because they are quite common, especially in females, a little more often than males, so something to watch for. Okay, so now we got that part done. The next thing we're going to do is we're going to assess her lower extremities. Now, she wouldn't have her clothes on normally. She'd have a hospital gown on. So I would be looking for any edema. She would have her shoes off. I don't see any concerns. I don't see any skin wounds or anything of concern. Everything looks even. There's not, one leg is not bigger than the other one. It looks really good. And then also I want to check her range of motion. I would want to check her strength too. So I would have her push against, resistance against my hands with her feet, and she could, can you push your feet like that? Yep. And then if I could feel that she's got good range of motion and also good strength in both of her legs and her feet. Looks good. And observing her feet, I want to make sure that I am looking, especially if someone's diabetic, I want to really take a good look at those toes, a look at the feet, make sure that the circulation, everything, the color looks good, the temperature looks good, that there's no ulcerations or wounds, especially in a diabetic, keeping track of those wounds, making sure that they don't develop into anything more. Wound care and really good foot care is very, very important with someone who is diabetic. So that all looks really good. Okay, and I think we're kind of wrapping up our assessment. When I do have her shoes off too, or when someone's feet, I could do a Babinski reflex check, which I would just take, I would have a tool in the office, but rub it on the bottom of her foot, and I would watch to make sure that her feet or toes curl in. If they don't, it might indicate some circulation or nerve issues or muscular issues. So that we did with her today looks good. She did a great job with that. So that seems to be it. Okay, I think we've done a good assessment. I could have her stand. One of the things that I kind of forgot to do, especially someone who's a little bit older, we'll look at, I'm going to ask you to close your eyes and lift your arms. And I'm going to look for a drift, straight out like this. There you go. Close your eyes. And I don't notice her drifting off to one side or the other, which is good. That could be, okay, you're good. That could be indicative of a stroke or some sort of issue like that. And I also, when someone is bare on the back too, I want to really look that skin over really well. Any moles, anything, make sure that everything looks normal and is good. So other than that, I think that is my head to toe assessment for Lana Charvat on my client Jane Doe today. Thank you.